us. My name is Keith Poza, and I'm the Director of Member Experience for Health Solutions here at USAA. It's a pleasure to be with you to talk about how Medicaid redeterminations may affect you or people you know. The purpose of today's webinar is to explain the latest Medicaid news that could impact your eligibility for Medicaid. We all know health insurance is a complex and sometimes overwhelming topic. Our goal today is to help break down what Medicaid redeterminations are, why you should be aware of what's changing with redeterminations, how it could potentially impact your health coverage, and what actions you need to take, if any. Important to note, if you're not enrolled in Medicaid or CHIP, the return of Medicaid eligibility redeterminations will not affect you. Before we get started, I'd like to take a moment to go over a few housekeeping items. First, you'll notice a button in the bottom bar of our Zoom webinar screen that says Q&A. Should you have any questions throughout the webinar, please submit them by clicking the button and typing your question in the box. We'll have time at the end of the webinar to address submitted questions. Throughout the webinar, we'll be running several polls. These will appear on screen and you can interact with them and cast your vote. These polls help our team understand the kinds of information you're most interested in learning about during today's webinar. Lastly, at the end of today's webinar, you'll notice a survey that will appear in your web browser. I ask that you take just a few moments to complete the 5-question survey to let us know how we did today. Your feedback is important and will help shape our future webinar events. That rounds out our housekeeping portion, so let's move on to introduction of today's speakers. Louise Norris is a renowned healthcare journalist and author. She's been a licensed insurance broker for nearly 20 years. She specializes in writing about health insurance and healthcare reform, focusing both on state and federal issues. Also with us today is Jerry Rourke, Senior Vice President and Director of Affinity Partnerships with IHC Specialty Benefits Group, a trusted partner of USAA. IHC helps us connect with well-known and reputable health, dental, vision, and supplemental health insurance carriers. Through IHC's connections, USAA can offer high-quality advice and health insurance plans to our members. We appreciate Jerry for his time and for IHC's support of today's webinar. Welcome to you both. Thank you for joining us.
Thank you.
Thank you for having us.
Now, for those who may be unfamiliar with USAA, I wanted to share a little bit about our mission and who we serve. USAA was founded in 1922 when 25 Army officers formed an association to insure their vehicles. Over 100 years later, and serving nearly 13 million members, our mission hasn't changed. We seek to be the provider of choice and provide that financial advice to our military community. All right, now for the reason you're all here today, to learn more about Medicaid redeterminations and why this is such an important topic. So let's queue up our first poll of the day. We'll take a few moments for responses to come in. Poll question for number 1. Prior to today's webinar, had you heard about the return of Medicaid disenrollment? Yes, I've already received my redetermination renewal letter. Yes, through news, internet, or some other source. No, or I don't recall. Okay, it looks like we've gotten some responses in. So I will end the poll here and share some results. It looks like we've got a fair amount of folks who have already received their redetermination and renewal, and some who've heard about it. Appreciate those of you who responded. Again, helps us understand where folks are that are listening to this webinar, and also helps us provide information. So appreciate everybody for interacting with that. Okay, we're going to move into a question asking portion for our panelists. The first question is for Louise. We're here to talk about Medicaid redeterminations and how states are starting to once again disenroll people who are no longer eligible for Medicaid. But the pause on disenrollment over the last 3 years was the result of a COVID-related public health emergency. Can you talk about what the public health emergency is and why the Medicaid Medicaid disenrollment process is resuming at this point?
Sure. So the public health emergency, we also call it the PHE, it was put in place in early 2020 just to create various government flexibilities to make it easier for all of us to cope with the pandemic. And then in March of 2020, the Families First Coronavirus Response Act started providing states with additional federal Medicaid funding, but it was on the condition that they couldn't disenroll anyone from Medicaid during the PHE unless the person died or moved out of state or actually requested that their coverage be terminated. So the PHE just kept getting extended for more than 3 years. It actually just ended last week on May 11th. But last December, the Consolidated Appropriations Act included a provision to set March 31st of 2023 as the definitive end date for that rule that had prevented states from disenrolling anybody from Medicaid. So the PHE was no longer relevant in terms of states being able to resume Medicaid disenrollment. Again, the PHE just ended last week, but Medicaid disenrollments resumed as early as April 1st in some states.
Wow, so that was a major event causing this whole process to kick off. Appreciate you sharing that. Now that we understand what the public health emergency is and how it affected Medicaid disenrollment, would you explain what Medicaid redeterminations are, why they're done, and maybe how often?
Sure. So Medicaid redetermination, it's also called renewal or case review. It's just the process that each state Medicaid agency uses to periodically review each enrollee's eligibility. In most cases, it gets done once per year. So prior to the COVID pandemic, the normal protocol was that if the state determined that you were no longer eligible for Medicaid, or if you didn't respond to an information request when your renewal was due, your coverage would be terminated. But that changed with the COVID pandemic. So states could continue to conduct eligibility redeterminations. They could send out those renewal packets and request information. And most of them did that. But prior to April of 2023, they couldn't disenroll anybody, even if they knew the person was no longer eligible or if the person just didn't respond to those eligibility redetermination packets. So that has changed now, and states have begun the process of returning to their normal eligibility redeterminations and disenrollments for folks who are no longer eligible.
Got it. Interesting that states could continue to go through their normal process, but couldn't disenroll anyone. And now it sounds like that's listed. So I guess, will this affect a lot of people? And maybe ask Jerry to weigh in on that?
Sure. It definitely will. During the pandemic, Medicaid enrollment has grown by about 20 million people across the country, reaching a record high of more than 92 million people in total. And there were a lot of folks who lost their jobs early in the pandemic and were able to enroll in Medicaid due to their income loss. There have also been people who became eligible for Medicaid due to things like pregnancy or just a temporary dip in their income. Normally, they would have become ineligible for Medicaid as their circumstances changed. But as Louise pointed out, states weren't allowed to disenroll individuals as a result of the pandemic. The Department of Health and Human Services put out an analysis last summer projecting that up to 15 million people would lose their Medicaid coverage once the pandemic ends. And just to clarify, that won't happen all at once. States have a full year to initiate renewals for everyone currently enrolled in Medicaid and up to 14 months to finish the entire process.
Wow, 15 million people. I guess it's good that we do have some time for states to accommodate that disenrollment process, but important to notice that it stated earlier, some are already beginning that process. Thank you so much for that, Jerry. Before we move on, let's do another poll question. We won't do this, display the results for this one because we want to be sensitive to everyone's answers, but this helps us know that we're sharing information that's important to you. So the poll question is, are you currently covered by Medicaid? The answer response is yes, no, but someone I know is. My child is on CHIP. I'm on Medicaid and my children are on CHIP, or none of these apply to me. We'll let those answers come in. But let's move on to our next question for Louise. Louise, how will people know if they're affected by this redetermination?
So since Medicaid is jointly run by the federal and state governments, eligibility rules and renewal processes do vary a bit from one state to another. So states had the option to start this process in February, March, or April, with the earliest possible disenrollment date being April 1st. But in some states that waited until April to begin processing renewals, the first round of disenrollments won't actually come until July. States have a year to work through eligibility redeterminations for their entire Medicaid population. And they have been instructed by the federal government to not process more than 1/9 of their total Medicaid population's renewals in any given month. So some Medicaid enrollees won't get their renewal notification until the end of this year or early 2024, and their coverage will continue until their renewal date. But everyone with Medicaid will have their eligibility rechecked at some point during this year-long process. Some states are just keeping each enrollee's regular renewal month, and others are prioritizing eligibility redeterminations for folks that they believe are most likely no longer eligible for Medicaid. So, and also for some enrollees, automatic renewal will be possible. So their state will just make their renewal determination based on information they already have on file and just inform them that their coverage has been renewed and they don't need to do anything. But if that's not possible, you'll get a notification in the mail several weeks before your renewal is due. And states are also increasingly reaching out to enrollees via phone, text message, email. So you might hear from your state in multiple ways. A lot of states are using different colored envelopes for the renewal notifications, or like marking the envelopes big red letters that say urgent, something like that, just to signify how important it is for people to respond to that renewal notification in order to keep their coverage.
Got it. So because this process is elongated out over several months, it's possible that although we saw some poll participants say that they had already received a notification, those notifications still may come at a later date. Louise, if I can ask, what can our webinar participants do now to prepare for this process?
So the most important thing right now is to make sure your contact information is up to date with your local Medicaid office. States are making multiple attempts to contact enrollees, but you will lose your coverage if they can't renew you because they just don't get the information they need to determine whether or not you're still eligible. So be sure to check your mailbox. I know it's easy to ignore your mail for a few days, but your state Medicaid office will send you a letter in the mail when it's time to renew your Medicaid coverage. This letter is important because it will include the renewal form to complete and send back to your Medicaid office. But they'll also give you a process for where you can complete it online or call them and go over it on the phone. But if you ignore it altogether, your coverage will terminate instead of being renewed, even if you would technically still meet the eligibility guidelines.
Great, thank you. So what happens if our participants don't get any notifications from their state's Medicaid office?
So again, it's important to remind folks here that they might not hear from their Medicaid office for several months. There has been a lot of buzz about Medicaid disenrollments resuming April 1st, but there were actually only a handful of states that really started disenrolling people on April 1st. Some states won't start disenrolling anybody until June or July. And in every state, this process is getting spread out over a year. So if your renewal is scheduled for next March, for example, you might not hear from your local Medicaid office until sometime around January. But again, it's important to make sure that the Medicaid office has your correct contact information on file so that they can get in touch with you when it's time to renew your coverage. A lot of states have online portals where you can log in and check to see when your coverage is due for renew, just so you know to keep an eye out for that, for the renewal notification that'll come, several weeks ahead of that date. But if you don't see something like that on your state's Medicaid website, you can call your local Medicaid office and just ask them if they can tell you when your coverage is due to renew. And you can also confirm with them then whether they have your updated contact information on file and just see if there's anything else they need from you just to make sure all your ducks are in a row.
Got it. So what I take away from that is there's no such thing as being too proactive. And also it is imperative that you make sure that your contact information is up to date with the state Medicaid office. So appreciate that rundown of all that our participants can do to ensure they're ready for when that disenrollment potentially occurs. While we're on the topic of responding to mailings, here's a quick public service announcement to be on alert for potential scams that might be out there. You don't want to disclose personal information to someone calling you unless you know for sure that individual and entity is legitimate. If you do receive a call that you didn't request, ask the caller for their name and phone number before engaging in any conversation. If still in doubt, discontinue the call and contact your county office to report it. Never give out personal financial information or social security numbers over the telephone. Never give out Medicaid information such as member ID numbers over the phone unless you're familiar with the caseworker calling. Also, be sure to report suspicious calls to local authorities immediately and contact your local Medicaid eligibility office. That's our quick PSA for the day, but I do have another question for Louise about our main topic, and frankly, probably why people are here for today's webinar. What should someone do if they get notified they're losing their Medicaid coverage?
So first, don't panic. You will have time to react and make a plan to get new coverage. If you're employed, you should talk to your company's human resources office to see if you're eligible for benefits at work and how much they'll cost. Losing your Medicaid coverage is a qualifying life event, so that will allow you to enroll in the plan that your employer offers, even if it's outside of the annual open enrollment period. If you don't have access to coverage at work, you can enroll in a plan through the health insurance marketplace, which is also called the exchange. Those mean the same thing. Depending on your income, you might be eligible for a tax credit or a subsidy that can reduce how much you pay for that coverage. More than 90% of all the people who enrolled in plans through the marketplace for this year were eligible for these subsidies, so they are widely available. If you've become eligible for Medicare during the pandemic, but you didn't enroll because your Medicaid continued, you will have an opportunity to transition to Medicare without a late enrollment penalty when your Medicaid ends. So if that's your situation and you're eligible for Medicare, we'd urge you to visit medicare.gov to find out more about that.
If I could, let me just add to that, Louise. If someone is notified that they're losing Medicaid coverage, you've got a couple of options. If you're currently employed, it's always best to check with your employer first to see if there's a group plan you can join. If that's not available, you can visit healthcare.gov to find plans available in your state. Or of course, you can always visit usaa.com/health insurance to review options as well.
Definitely.
Thank you both for providing all those resources available to individuals who are facing this Medicaid redetermination event. Very insightful about the open enrollment opportunities and the qualifying life events, regardless of circumstance. Really appreciate that insight. Okay, so we've got our final poll of today's webinar going up in just a moment. All right. I apologize. So we're going to move on to a question and then get to the poll. Okay, here we go. The poll question is, from what I learned today, I intend to update my info with Medicaid, search my mail for a letter, check out USAA's website, call a licensed agent, or nothing. Give just a few minutes for a few moments for the responses to come in. Okay, looks like the popcorn has stopped popping, so we'll go ahead and share results here. And it looks like we've got a healthy degree of variety across the board. I see the one that comes in most is update my info with Medicaid, which, as we said early, is definitely important, knowing that Medicaid will be reaching out through various means to make sure that the info is up to date with your local Medicaid office. Okay. So with that, we'll transition back to, I've got a question for Louise. If I get a notice that I'm losing my Medicaid coverage, how much time will I have to get other insurance coverage?
So this can vary depending on the coverage that you're going to transition to and where you live. But as a general rule, you're going to want to sign up for the new coverage before your Medicaid actually ends so that you can avoid a gap in coverage. So in most cases, if you're signing up for an employer's plan or a marketplace plan, the earliest available effective date for that new coverage is going to be the first of the month after you enroll. So the special enrollment periods for these plans will continue for at least 60 days after your Medicaid ends, but you'll generally have a gap in coverage of at least a month if you wait and sign up after your Medicaid ends. So for example, let's say your Medicaid is ending August 31st and you sign up for your employer's plan or marketplace plan on September 1, you're almost certainly going to find out that that new plan won't take effect until October 1st. But if you submit your enrollment for the new plan on August 31st, then your new coverage can take effect on September 1st, and you don't have a gap in coverage. You transition straight from Medicaid to the new plan. One note about marketplace coverage. So there are 33 states that use healthcare.gov. That's the federally run health insurance marketplace. In those states, there's a special enrollment period that started back on March 31st of this year, and it goes all the way through July of next year. So that's for anybody who loses Medicaid in those states during that, anytime in that 16-month window. So that gives folks in those states a lot of leeway in terms of when they can enroll. But again, that coverage is not going to be retroactive. So the best bet is to sign up as soon as you get notified that you're losing your Medicaid, so that you can just transition straight to the new coverage without a gap.
Got it. I appreciate that because I think it's important to understand and be, again, proactive so that you don't have a gap in coverage between when your Medicaid coverage ends and whatever the next plan that you go on. Very informative, and I appreciate the information. Thanks to you and Jerry for your perspective as well. Before we move to the Q&A portion of today's webinar, I'd like to remind our audience that if you're notified you no longer qualify for Medicaid insurance coverage, be sure to visit usaa.com/health insurance to learn more about the health insurance plans that USAA offers through our partner, IHC Specialty Benefits. You can also visit healthcare.gov to find plans in your state or speak with your employer to see if there's health plans available to you at your place of business. If you have questions, you can also call 855-230-1883 to speak with a licensed insurance agent. With that said, let's begin our Q&A. We've had several questions come in from the audience today, so thank you for submitting those. You can still submit questions by clicking the Q&A button at the bottom of your Zoom window, and we'll do our best to address as many as we can. All right, so let me take just a moment here. Okay, so we've got a question around the ACA plan. Does an ACA plan automatically begin when the Medicaid ends? I'll kick that to Louise or Jerry for response.
Sure, I can take that one. In most cases, no. State-run marketplaces, the ones that don't use healthcare.gov, they can choose to set up their own processes with this. So there are a couple states, California and Rhode Island are examples of states where they have created an automatic transition process for at least some folks who lose Medicaid to get them enrolled automatically in a marketplace plan, but that is definitely the exception to the rule. In most states, your information may be transferred to the marketplace, but you have to go in and actively enroll and then get yourself situated with that plan before your Medicaid ends, preferably, so that you don't have a gap in coverage. But it does take an active enrollment process in most states.
Got it. So make sure you're active. Don't assume that there's this automatic process that takes place. That's great. Let me see. Okay, here's a good one around pre-existing conditions or existing medical conditions. It says, can I be denied for coverage if I have an existing medical condition? Again, Jerry or Louise.
I can take that one. Keith. Generally, no. But there are a few types of health coverage that can reject an applicant due to their medical history. But they are only plans that aren't regulated by the Affordable Care Act, things like short-term health insurance and fixed indemnity plans. As long as you're enrolling in an employer plan, an ACA compliant individual market plan, or basic Medicare, you don't need to worry about your application being rejected due to your medical history. For individual market plans, this is true regardless of whether you enroll through the marketplace or directly through an insurer. And if you've turned 65 during the pandemic and will be transitioning from Medicaid to Medicare, you'll have a 6-month window to sign up without medical underwriting.
Got it. So not every plan, but there are certain plans that you're protected from that sense. So I appreciate that information, Jerry. Thank you so much. Okay, here's one that is, I think, germane to our audience, particularly from a USA perspective as we serve veterans. Do y'all have any insight on if it impacts if they're on TRICARE, if it impacts them?
Sure, I can address that. So if you have TRICARE together with Medicaid, your TRICARE is primary and your Medicaid is secondary. So if you're losing Medicaid at some point during this year-long process, it'll be your secondary coverage that you're losing. You'll still have your primary coverage, your TRICARE. If you have multiple TRICARE options available to you, the loss of your secondary Medicaid coverage will trigger a 90-day special enrollment period when you could make a change to your TRICARE coverage. So just to keep that in mind.
Awesome. Awesome. Okay, let me see if I can find another one here. Okay, this one, Jerry, you mentioned Medicare earlier. So can you talk, if you have any more information on how it impacts folks who are eligible for Medicare? I think you might have alluded to that earlier, but maybe you can expand.
Sure. Yes, it does. It does affect people who are eligible for Medicare, but only if you are also enrolled in Medicaid. If you become eligible for Medicare during the public health emergency, but were covered by Medicaid, you might not have enrolled in Medicare when you were first eligible. And if you're no longer eligible for Medicaid, your coverage will be terminated when your state rechecks your eligibility. And that'll give you a 6-month window when you can enroll in Medicare without any late enrollment penalty.
Got it. Okay. I think we've got time for one more. So let me see. Okay, so for individuals who maybe haven't been in the individual or haven't had a plan through the employer, Louise or Jerry, can you talk about the biggest differences between what they've had with Medicaid and then what they would potentially be transitioning to for either individual or maybe they get a plan through their employer?
Sure, I can take that, Louise. For most Medicaid enrollees, there are no premiums and cost sharing is minimal or even free for some services. And that's going to be the biggest thing that people notice as they transition to commercial health insurance. But it's important to note that the American Rescue Plan's subsidy enhancements have made it a lot easier for people to afford really good coverage in the marketplace, including plans with strong cost sharing reduction benefits. Some people who transition off of Medicaid will find that they can actually get free or nearly free coverage in the marketplace that has relatively low cost sharing. It's also important to understand that commercial health plans have limited enrollment windows, whereas Medicaid is available year-round to anyone who's eligible to enroll. So for example, folks who transition to an employer's plan generally have 30 days after their Medicaid ends. There's not an open-ended opportunity to sign up. And if you miss the initial window, you'll have to wait until your employer's next annual enrollment period.
Got it. So make sure that when you start the process of transitioning, if you're impacted and you're transitioning off of Medicaid onto those either employer-based plans or through the marketplace, that you act within that enrollment window so that, again, you don't have that gap in coverage. Just make sure that you're being proactive about that process. That's all the time that we have for questions today. I do want to say, if you submitted questions, we are committed to researching those, reading those, and responding to those as a panelist group. And of course, if you always have questions, 855-230-1883 to talk maybe about your personal situation. Also, again, those list of resources that are there, checking with your employer, making sure that you visit usaa.com/health insurance. There's just a number of ways for you to resolve your situation or get your questions answered. So to wrap up today's information, the process of returning to normal Medicaid redeterminations and disenrollment is happening now. If you're on Medicaid, we strongly encourage you to update your contact information with your state's Medicaid office so you don't miss any notifications. Each state is rolling out to their own specific redetermination process, so it's best to check with your state's Medicaid office to learn more. If you get a notice that you're losing Medicaid coverage and you think you're still eligible, you can appeal their decision. Make sure that your state's Medicaid office has all the correct information, like your income, how many people are in your family, etc. If you're losing coverage, as Louise said, don't panic. Reach out to your employer to see if you're eligible for benefits at work. If not, shop for coverage in most states by going to usaa.com/health insurance. And you can also view available plans by visiting healthcare.gov. And for our final reminder, we would appreciate your feedback on today's event by completing a webinar survey. The survey will appear in your browser window once we conclude the webinar. Thank you for joining us today, and a big thank you to our speakers for their time and expertise. Have a great day.